the future generation. Okay. So these are highlights of what we're gonna kind of cover today. We'll be unpacking a couple topics, and I did do a survey with a couple of the parents that I am friends with on Facebook to kind of get an idea of what people want to talk about as far as from a parental perspective. So, so this is the basic questions that when I answered their questions kind of came up as statements for me, like the different points. So the first one was parents affect their children's mental health. Whether it's intentionally or not, we have a very big impact on the mental health of our children. And then the second one is societal influences can act as a buffer. So we're going to briefly cover how daycares, how schools, how other people can change the trajectory, even if at home is unstable, someone else can come in and kind of stabilize the mental health of the child to change the trajectory of where they're going. So if it's like going like this, someone else can come in and twist it to make it go upward. So that child doesn't suffer from anxiety or depression or any of that sort, even the genetics of it all. So the last one is empathy and empowerment are keys. These are just, that's one big solution that is pivotal in a lot of different things because a lot of us don't show empathy and a lot of us weren't given empathy in order to show empathy. And empowerment can is a big driving motivational force that can change the life of anybody if it's done correctly. Um, so each of these statements goes back to the central theme of this entire topic, nurturing wholeness, which is the mental journey of infants and toddlers. Okay. So on the screen, you notice 5 different apples, and they're all doing their like own little thing. But I want you to shift your perspective just a little bit and look at this from a different lens. So you see apples and you see they all have their own unique characteristics. Now I want to ask you the questions on the screen. So what is the first thing that you notice about the 5 apples on this screen? And then I also want you to ask yourself, why is that the first thing that I noticed? And then as you're pondering that, because there should have been some thought or even a past reflective moment, or even something that you just cannot stop thinking of that you just, popped into your head. Did your parent or even another adult ever tell you that one bad apple will spoil it for the rest? And while you're thinking about that, these questions are designed to provoke thought, to kind of get your mind rolling, to reflect it back to different points in time that may have came up. And this is just to challenge our perceived notions of these apples. And not everyone noticed the same thing first, but our perceptions are shaped by our experiences from the time we were a baby to whatever age we are now, and their conditioned beliefs or thoughts, because some of our thoughts are not always our own thoughts. But I do want you to consider this one thing. If we use the one bad apple spoils it for the rest, right? What if the one bad apple in this bunch was simply an apple that wasn't nurtured properly from the infant stage until whatever age you want to give it? I say that because this analogy reflects how our society often approaches mental health, especially when it comes to the youngest generation. Um, So I want to go into the next topic, which is societal conditioning. And it's not all bad, I promise. But I want you to think about it from the apple analogy into this. So these are four M's, which is mislabeling, misunderstanding, misdiagnoses, and minding our business, which we hear a lot on social media and probably even in our inner circles. So when it comes to sorry, we are familiar with groups, specifically on Facebook, where we share our experiences and some of them give their unsolicited advice. Now, these can be great sources of support if needed, but it can also be a minefield of misinformation because in many of those groups, you have, just people who are mothers who have been through the same thing and they give their opinion. They tell you what to do. They tell you what your child could possibly have, even if it's not true. And it's like going into this jungle and you don't have a map, you don't have a compass, you don't have anything. And they're telling you all these different things that your child could have based off of signs that you've noticed, things you may have read on Google, and you're fearful of going to get a professional advice just because, someone in the group may have told you don't go or don't go this particular doctor. And it's just, then you're kind of like labeled as something that you're not, or your child is, and you're thinking, okay, my child has, for example, ADHD, just because, you presented signs in this group. And I don't want to really talk about the specific signs because that's not what I'm trying to get at. I'm just want to make a point that if we go into parenting groups, we tell signs, we're asking for advice, when we're mostly seeking empathy and support. And someone tells us, well, my child experiences this, and it was ADHD, so your child has the exact same thing. So then what happens is our fear of going to a professional is the fact that this person said this, and I don't want to go because I have my own preconceived notions of, therapy, or it's a stigma, and I don't go. So my child's been mislabeled with ADHD for this long period of time. And then when they go and they finally, I finally take that step to take them, it's not that, it's something else. And I've been treating my child a certain way because, they were mislabeled in a Facebook group, which happens more often than we actually think. So then we go to the second one, which is misunderstanding. TikTok, for example, we have the dance challenges. We see these cute pet videos. We see people cooking. We see all these things, and then we see people talking about information. And like we're dialed in and we're watching these people that we've grown to trust. Some people love them, and we share their information out. So we're in this information age, and TikTok is the quickest way to get information out there. It is one of the fastest growing social media platforms, so why not, right? What's happening is that you can almost call it like a game of telephone, where we have this one central topic, and the more that it goes to different people, it gets lost, it gets distorted. And what's happening is it's leading into a growing mistrust of professionals. So this one person, this one influencer, let's call this influencer Todd. We trust Todd. We love Todd. We send his videos, in all our mom groups, all our parent groups. But then he says this one thing about, a mental health professional where he sent his child there. They told him the wrong thing. And what happens is when that happens, we grow to mistrust other mental health professionals because we trust Todd. Todd has gained our trust. And what ends up happening is even if there's an apology to be had to that mental health professional that Todd misunderstood, nine times out of 10, they're not going to apologize. They're not going to fix it. So then we're kind of like, okay, the audience never knows that there was a misunderstanding. The audience will never know that there was an apology that may have been had off camera. And yet the influencer doesn't have to apologize on there, but it's the thing of we're misunderstanding this person's, whether they're hurt or angry in the moment. We took it as, I understand your pain. That person, lied to you. That person told you all these things that you didn't want to hear about your child. And we take it as truth because, again, TikTok is an informational platform that spreads like wildfire, whether it's good or we perceive it as bad, which then what goes into misdiagnosis. So every year there are countless children that are misdiagnosed, whether by their parent, even professionals may get it wrong. Um, and even us as parents can get it wrong because no one's perfect. But according to the National Institute of Health, 17% of early childhood, which is infants and children, have some type of mental health challenge. And that was based off a 2015 study. That's not even 10 years ago. So there are a lot of things that can happen in a misdiagnosis. Again, no one's perfect. But what's happening is that we want to self-diagnose because of, again, the lack of trust, the lack of information. I'm going to call it information rebuttals. um, so we have to stop. We have to listen to that intuition that we have as parents and also as professionals to look beyond look into the gray area of what it is. So even if someone says, okay, well, I feel like your child may be a little depressed, look further into it. I never take what someone says as like truth. I always go beyond and look at it myself. But when I was pregnant, I Googled everything and it did make me depressed. Honestly, it did. So from personal experience, I don't Google. I will go to the counselor. I'll go to, a professional and I will seek their advice because I know where misdiagnosing anything has led me personally and also with my children. Um, and then the last one, minding your business. I know we've all heard this. I know we've all seen it and someone said it, and it's not a healthy thing. If I want to be really honest, we live in this culture where we often turn a blind eye to other struggles, especially when it comes to mental health. We see signs, we see signals, we see all these different things, and we never say anything. We just kind of let the person spiral. We let them go after challenge, and we never say anything. It's like we're wearing an eye mask and we're only focused on ourselves and on our families, and we're oblivious to everything that's happening around us. So if we see this child who is clearly struggling, we see this infant not hitting milestones, we're not, asking the parent anything, even if we're just friends. There's a way that we can show empathy to ask, have you taken your child to the doctor? I mean, you don't have to be very straightforward, but it's showing that you empathize and you're showing support, but you're also showing love to that person. And even if you have to attach it back to a personal story, whether you went through it or someone you know, that's kind of empowering that parent to kind of seek further help, to kind of say, okay, I see that my child is, behind on walking. My child's a year and a half, and they haven't walked. Let me go to the doctor. Because a lot of parents don't want to go to the doctor and, want anything to be wrong with their child. They don't want to hear the different diagnoses of what it could be, what it is, what they have to do, because sometimes that'll stress somebody out, and they have to add, an extra something else to their routine, whether it be their kid have to wear a brace or their kid have to wear the thing on their head when they have to shape the head and they have to take special care of the baby, different things, because that can stress somebody out. Um, because that's one thing that you have to add to the routine that you probably already perfected. And I say that from someone who's had anxiety. Um, it's a lot. So even if you see a parent that has twins in the store and they're struggling to put the stuff in the basket because one is crying and the other one's running around, help. You can say, do you need me to get milk out of there for you? Do you need me to push the basket for you? Like, what can I do to help you? And that mom may be stressed out, and her child may be, for example, autistic. And instead of her having to tell you all that, you could just help. And that will help her, and then it will start a ripple effect of not minding our business. Um, So I challenge each of us to think differently, to question our perceived notions, and to consider how we can play a part in changing the narrative. But I do want to present this question. What signs may be missing? How can we better recognize and respond to them? So I want you to keep an open mind and shift your perspective. So I want you to picture this. You're in a daycare, or maybe you're at the grocery store, or perhaps you're in a park surrounded by children. So we all know the big indicators of mental health issues in infants and toddlers is feeding problems, delayed milestones, lack of verbal communication, and the list can go on, right? But what if we could look beyond the signs? What if we could pick up on subtler signs and respond in a way that could potentially change the trajectory of a child's mental health? So, presented here, sorry. So, changing our perspective from labeling to understanding. So, instead of quickly labeling a child's behavior as problematic or abnormal, let's strive to understand what's causing the problematic behavior, what's causing them to act differently than the other children. It's like taking, we went from black and white screens to color screens. You see something different. You see things you might have missed because now it's in color. So we have to do the same thing when we're trying to understand what is going on with this particular child. And then the next one is using words that encourage support and nurturing. Words are very powerful. And the language we use can either stigmatize this parent or we can support this parent, right? It's like choosing between a cactus and a hug. The cactus is going to be prickly and it's going to hurt. But if we choose a hug, it's more warm and it's more nurturing. So words pierce, they can cut deep. And if we use different words, words that give you like empowerment and like all this energy, those are words that can empower that parent in a nurturing way to get their child the help that they need and also be open to receiving what you're saying. The third one is recognizing signals and providing the necessary support. So it's like being a detective, picking up on clues that others might miss and using them to provide the right kind of help. We don't want to ever go into anything blind per se, but if we notice certain things, we can guide them in the right way. Because sometimes you have to guide someone to become aware of a problem or a challenge. Because everyone doesn't receive information in a very straightforward, blunt way. There are some that have to, you have to hold their hand There are some that you can show a video to, and it'll be like, okay, light bulb goes off. There are some you have to actually put in that environment, and they can see firsthand, okay, I've gained the awareness for this. I understand what you're saying. Because if we tell someone something straightforward, it might not always get the reaction that we thought about or visualized. Um, which leads me into the last one. Providing additional support and nurturing can make a long-term impact and be beneficial. It's like planting a seed and nurturing it because the right care and attention, it can become strong and a healthy tree. So when you take a parent and you tell them what's going on in a way that they understand, because again, everybody's different and we can't be broad about how we tell people information. We have to kind of be individualized when we do it. And then when we do that, we not only nurture that parent child bond, we also help that child in a mentally well way. Um, so I want to go into the role of the parent since I just brought that up. So the goal is not to identify the signs of mental health, but to look beyond and find ways to foster the mental wellness, which the parent plays a pivotal role of. Because again, we as parents shape the child's mental health in more ways than one. So even when a parent is dealing with their own mental health issues, they can still provide that supportive environment for their children. And here are those ways. But I also want to remind you guys that a parent with a mental health disorder, there is a possibility that that parent can create a dysfunctional environment for the child. And I say that because when a parent has any type of mental health issues, I'm going to say mental health issues, mental health challenges, they don't dedicate the time to that child. And sometimes the child may not even get to see them only when it's to feed, change the diaper. They're probably literally waiting for that child to go to sleep. And I say that more so geared toward parents with postpartum depression. Time isn't really given to that child. And it's not necessarily about the quantity of time, it's more so the quality of time. So even 15 minutes, if that's all you can give, that's enough time and that could be a good quality 15 minutes. It could be where there's brackets where, I have playtime here in the morning, and then the middle of the day we go for a walk in the park. And then at night it might be we watch, Coco Melon or something on TV. It could be something like that. That can be a strategy where the parent is able to give that child quality time, even if that's all they can give because they're also struggling themselves, if I'm making sense. And then communication. Again, if a parent has, if they're working, they're stressed, they're overwhelmed, they're depressed, they, have OCD, whatever the case may be, most kids now lack emotional intelligence in more ways than one, and that's based off of an observation. And even as adults, there are some adults who don't know how to emotionally express themselves very well. And it could have very well started, at this early age. Because emotional intelligence and communication can help validate a child's feelings. Because personally, I didn't know how to validate my feelings. I never really thought feeling or crying was okay. I thought something was really wrong with me the first time. I was like, okay, I'm crying like every day. But I didn't know how to really express what was happening. I didn't think, I thought crying was for weak people, if I'm being honest. um, because that's what I was told. And so I went my entire, 25 years of life before I had my first child thinking, I'm not going to cry. I'm mentally tough. I'm not going to cry. But then when I cried, I felt the weakest I've ever felt until I started, you know, I did have to seek help, but I started seeing it as a tool of empowerment. I feel like I was releasing when I was crying. And I found people to actually go and talk to that were, I felt safe. So now when my children cry, I ask them, what's going on, what's wrong, what happened. And most of the time it's because they can't have something or they want to go somewhere and we can't go at that particular moment in time because, there are certain things that happen when you get home because homework is very important. But it's those things. Like I tell them to express their feelings. So when they cry, I validate that and I ask them why I honor that emotion. Even when they're angry at me, I honor that anger and I ask them why and we work through it. There are different ways I work through it because it's very different with both of them. But with one of them, I can sit down and have a conversation like I'm having with you guys, and she's 4. The other one, I kind of have to hold and nurture and give a hug and probably go watch a movie with. And that's my 6-year old. She's more emotional than my 4-year old. But I know that from kind of spending that, again, quality time with them and learning who they are and their behaviors. And same thing with their teachers. They learn their behaviors and we're able to communicate. And if there's anything going on, I'm able to be open enough with them to say, hey, they're having a bad day. They're going to need some extra attention today, or they might need some extra encouragement. And that's when we get to the last one. Consistent encouragement through resources. Like it can be saying phenomenal things to them before they get out the car. Even if they are, you know, 12 months old or 6 months old. For some reason, I'm not sure the science behind it, but babies understand what we're saying. Because if we're having a bad day and we don't, say I love you before we drop them off at daycare, sometimes I do honestly believe that they remember those things. Because I know when I dropped my youngest off, she was always happy. She ran when she started walking. She would run to the door and give me a hug. And I would just tell her, I hope you have a phenomenal day at daycare. That was it. And then when she get home, she'll say, I missed you. And she's like, I had a great day. When she was able to talk, I had a great day. And I do that every day. I still do that to this day. Because even my pre-K daughter, she cried all this week. And today I had to tell her, I asked her why she cried, and she said she missed me. Because she was out of daycare for a year before she went to pre-K. And I told her, I'm always with you. I'm not that far away, which I'm not. And I told her, you're the leader in the class because she wants to be this leader. And I was like, you have to show them that, it's okay, even if they cry. So when there's other kids that cry, she does go and she gives them a hug and she's like, I'm here, it's okay. Our parents will come back later. So she's more so resilient in that way. And I literally can talk to her exactly like I'm talking to you guys, and she understands. So we have to remind ourselves, and also professionals, you have to remind parents that it's not about being a perfect parent because none of us are perfect, right? We all mess up, we all do something wrong, and we always, there's nothing wrong with asking for help. But we have to remind parents to be present. It's not about perfection. It's about being present and being there for our children. And so the role of the professionals institutions, when I say institutions, I mean the daycares, the organizations, you can even say that the pediatricians' offices. These are all places that can help with that buffer. And that buffer is changing the direct trajectory of where our child is mentally. So they play a crucial role in stabilizing our children's mental health, especially when the home environment is either challenging, dysfunctional, or becomes overwhelming. They provide that safety net that offers routine, stability, social interaction, and early intervention of any mental health concerns that might come up. And it's about creating this supportive environment that helps children bounce back despite their home situation. Um, and I say that because there's many conversations where we talk about rebuilding the village. And that village is people that we can lean on, um, people that can help us with our children, because a lot of people are silently going through depression, anxiety to some extent, stress, they're overwhelmed, and they have really nobody to lean on, nobody to tell them that, hey, these are things that what your mental health is affecting your child, not as direct, but in a way that they understand. So them stressing is eventually going to cause their child to develop that same level of stress, whether it's the same or greater. And also, if a parent has a genetic, not genetic, if the, I can't think of my words, mental health is hereditary that the parent has, that child will either get the same level of that or worse. And they might not be able to know how to deal with that. So that's why rebuilding the village, whether it's just helping that parent in the grocery store, like I used earlier, or it's just showing up and just being supportive, or even just building these villages ourselves, will help the mental health of these babies, which is very important because some kids, they're just at home with their parents all the time. I've seen this firsthand. And then when they get to, 3 years old, because there are some kids that go in the pre-K 3 and they go into these places, they don't know how to interact with the other kids. And you may call it, abnormal, that's weird, something's wrong with them. The interaction that happens, it's okay for, I mean, babies play with babies, but most people have some type of anxiety level or their OCD and they're not realizing these things, right? And that child grows up to be kind of what we call socially awkward. I mean, even COVID had some of us socially awkward, myself included. So it's those things that I guess we have to be mindful of. So I do want to share some initiatives that are changing lives for babies and their parents. So there's a 0 to 3 organization. They work to ensure that our babies and all babies and toddlers have a strong start in life. They provide professionals, parents, as well as policymakers the knowledge and know-how to nurture and develop these a younger generation. And then you have the Infant Mental Health Journal. They are a peer-reviewed journal that publishes key research into the mental health of infants and their families. It's a great resource if you're a professional listening in. And then you have the Brazeltone Touchpoint Center. This organization focuses on strengthening the families of infants and toddlers. They provide resources and training for professionals to better support families during these early years. And then you have the Early Childhood Mental Health Program. This one's based out of San Francisco, California. They provide comprehensive mental health services to young children as well as their families. So these organizations, as well as many others, are helping shape and fostering mental wellness for these babies. So now we talk about empowerment and empathy. And these are not just concepts, they are tools, powerful tools that can help infant and toddlers along their mental wellness journey. By empowering our younger generation, we give them a sense of control and autonomy where they can validate their feelings and also teach them emotional intelligence, setting the foundation for healthy emotional development. It's again about planting the seed of mental wellness early so they can grow up to be mentally resilient individuals. It's a beautiful thing when you can empathize with the child, but also empower them to go beyond where they are, whether it's mentally um, just striding to reach the next milestone, whether that be potty training or, walking, eating broccoli, or whatever the case may be. And these are just a couple successful studies they have done on empathy and empowerment. And this one's just for ages birth to pre-K. There are some that they have done on children in middle school, elementary, and even high school. But the first one is the role of empathy in improving mental health outcomes. It was a study on elementary kids. This was in 1995. This particular study found that children who were taught empathy in school had significant lower levels of anxiety and depression. And then the next one is the impact of empathy-based intervention in early childhood, which was done in the year 2000. This study found that early intervention of programs that focus on empathy can significantly improve the social emotional development of infants and toddlers. And then the next one is the role of empowerment in the social emotional development of pre-K students. Children who felt empowered in this study that was done in 2005 had better social emotional outcomes. And these are 4-year-olds. And then the next one was done in 2010 was empathy and empowerment. These are keys to healthy attachment in infants. So empathy and empowerment are crucial for healthy attachments in infants, which is a key factor in their mental health. And that is what that particular study found in 2010. And then the last one, the effect of empathy-based intervention on the mental health of pre-K kids, which was done in 2015, less than 10 years ago. Empathy-based interventions can significantly improve the health of pre-K children. So empowerment and empathy isn't just something that was like, oh, a spark of idea. These studies have been done clearly, as you can see, since the 90s. And they've worked and they will possibly continue to work. So as we're wrapping this part of the presentation up, I want you to ask yourself these questions. The next time a child of any age is signaling something and you want to take action. So the first question would be, how can I show empathy to this child in this moment? And the next one could be, how can I empower this child to express their feelings as well as their thoughts? And then the last one, what steps can I take to implement empathy and empowerment in my daily interactions with children? And what these 3 questions will do, they're thought-provoking questions, but they're to help change the narrative, to help foster the mental wellness of the infants and toddlers, to kind of get us to think in a different perspective, to truly show empathy towards this baby, and to also empower this child to open up in a trusting way and change the directory of their mental health. Amanda, is it okay if I open it up for questions?
Yes, absolutely. I have not seen anything come into the chat, but we do still have a couple minutes. So if anyone has any questions or things that they would like to share based on the presentation, feel free to turn your camera on and unmute, and we can have some discussion. Any questions or comments from anyone? And if we don't have any, then we can give you all back just a little bit of your your time for the afternoon. Um,
I said,
last call. Yeah, go
no,
ahead.
no questions. I was just taking it all in, just enjoying some of the things that I was hearing. Thank
Thank
you.
you. I appreciate that.
Thank you.
You're welcome.
All right. Well, if there are no other questions, then we will conclude our presentation for this afternoon. Again, thank you so much for joining us. Please keep an eye out for an email with a brief evaluation form about today's session. If you have not had an opportunity to take a peek at our other sessions that are scheduled, we're currently scheduled through February of 2024, which is crazy to just to say that we're already thinking about that time frame, but feel free to take a peek at some of those other sessions and join us for any that you might be interested in. If you have any questions, comments, anything, topics or things that you would like to see come up in these presentations, please share that information on the evaluation, and we will look forward to seeing you all at another presentation soon. Thank you so much, Cora, for being here with us this afternoon and this
Yeah.
morning. And we appreciate your time. Oh, yes, Veronica has a question. Please go ahead. So Veronica, you should, if you have a microphone and you want to go ahead and turn that on, feel free to ask the question that way, or if you're more comfortable typing it in, that's okay too. Okay, Veronica, I will get with you and make sure that you can get that registration for the other trainings. Let me actually really quickly, I will just pull up the information for our events here with the website. So when you are looking at the website, then you will actually be able to see each of the event sessions that we have scheduled up until February. When you click on that, you should be able to get into that particular session's registration. So certainly if you have issues or problems, there is a way that you can contact us through that form. So please let me know if you're having any trouble and we'll make sure that we can get you in for those. Oh, Tina, thank you for sharing about your experience as well. Appreciate that.
Excuse me, how can we get a copy of this recording?
So this recording will be available on the Mental Health Association of Maryland's YouTube channel. It usually takes us a little bit of time to get that up there, but if you go to YouTube and just search for the Mental Health Association of Maryland, you'll be able to see that probably in the next week or so.
Thank you.
You're welcome.